technical glitches, as they say on Broadway, once again with feeling. We're back with Josh and Paul and Commissioner Miguel Cardona, since we're going to be talking about schools. And very pleased that we have Dr. Suzanne Lagarde here from the Fairhaven Community Center, since we will be talking about testing as well. Let's go to the COVID Daily Summary, if we could. What you see here is 3 days worth of numbers. I think a couple of things strike me. One, 4.8% positivity. That's a little less than we were used to last week. Don't jump to any conclusions, but our average positivity has gone on a weekly basis from 5.8 to 5.5. I think you are going to see it bouncing around. I do worry that the upward trend could continue. Hospitalizations, 27. We had 60 in a 3-day period last week, but let's watch those numbers carefully as well. I think you know why. Fatalities, 43. 3 million tests. We have now done 3 million tests. It took us 5 months to do the first 1 million tests. It took us 1 month to do the last million tests. And that means we're doing everything we can to get ahead of this virus, test those most at risk, go to our nursing homes, first responders, and each and every one of you on a broad base so we can figure out how we stay ahead of what's going on here. And that's why I think the testing is very important. We'll talk about that in a minute. Next up is Step Up Connecticut. Step Up Connecticut reflects the fact that last time when we got hit, which was in that spring period, we were worried about material shortages. We were worried about masks and gowns. We were worried about hospital beds. We were worried about lab capacity, so we'd be able to do more testing. I think now, here we are, some months later, we've got the masks and gowns and PPE and stockpiled. Our hospitals are in pretty good shape there. We know we have the ability to expand bed capacity. When it comes to testing, you've seen that we're now at over 200,000 tests every week and able to ramp that up with one severe caveat, which I want to talk about, and that's people. So what Step Up Connecticut is an opportunity for you to go to ct.gov, Step Up Connecticut, and step up, because we could use your help. Look, we have we're sending all of the colleges home, something we had anticipated. That means there will be a lot of college-age students. Look, you can binge watch Netflix for 3 weeks, but we have some other ways that you can really be of assistance helping your entire community get through this pandemic. One, when it comes to hospitals and the fact we have a lot of doctors and nurses, many working a double shift, get some exhaustion. Any healthcare experience at all, please go to Step Up Connecticut and see if you can step in and help us out in a whole variety of different ways, depending on your skill level. Same question when it comes to supporting our testing sites. As you know, people are waiting in lines, and those lines reflect the fact that more and more people want to get tested. We have the lab capacity, but we are trying to expand our capacity for people to take the swabs and expand the lines we have there as best we can. And the way we do that is with more people. We need you there. You can help administratively. You can help with the swabs, help manage what's going on there. Go to Step Up Connecticut. We could use your help. And finally, it's our schools. And as you know, when it comes to our schools, right now, we're finding that if schools have to close, the reason generally isn't due to a high positivity in the classroom. In fact, the positivity rate tends to be lowest in the classroom, but it does seem to reflect the fact that sometimes staff have to quarantine. You have teachers who are older, teachers with a pre-existing condition, and those are the places where we need people to step in. So again, if you go to Step Up Connecticut, what you can do there is find if you have a teaching or social work or a general love of kids as a senior in college, we may be able to find you paid work at some of our schools. Look, it'll be an experienced teacher who's perhaps quarantining, zooming into the classroom, and you can help out in the classroom. Social, emotional, tutorial, and keeping an eye on the kids themselves who are there. Those are just 3 ways that you can help out Step Up Connecticut, volunteer as well as paid jobs. Look forward to seeing some action on that site pretty soon. Let's go to the next one, Max. As we come up to the Thanksgiving Day on Thursday, I thought this was sort of interesting. We did an analysis. If we said, look, if you have no more than 10 people at your table, and they're not all people you know, these are not necessarily from your immediate family. Maybe it's a friend of a friend. If it's a random group in Fairfield County, you've got a 24% chance that one of those people is infected. New London County, it's only 14%, but don't get overconfident there either. I don't say this to scare you. I say this so you understand why we've had a limit of 10. I say this to remind you why it's so important you keep to your particular cohort, your immediate family, this Thanksgiving. That'll mean you have a much better chance for Christmas and Thanksgiving next year that's safe. And by the way, if it's 20 people around that table, you can take these numbers and almost double them. You can see why we're trying to be so cautious when it comes to the Thanksgiving holidays coming up. This next picture is just a odd one, but I was amused by the fact that small turkeys are selling like hotcakes, I guess was the old phrase. With smaller groups, 4, 6, 10 around the table, we don't need the big turkeys, so you're going to find that smaller turkeys are what's selling right now. Maybe a trend for the future. And finally, I just wanted to showcase this headline from the New York Times before getting Suzanne Lagarde on. This just reminds us that, look, you're all getting tested. Folks coming back from college are getting tested. And a negative coronavirus test doesn't mean, yippee, I'm home free. Far from it. We strongly tell you, you got to continue to wear the mask, especially if you can't social distance. Do both if you can. I know this is tough. I know we got to do this for another couple of months, but it'll make a world of difference. With that, Suzanne Lagarde has done amazing work at the Fairhaven Community Center, doing yeoman's work in getting more people tested. And she has an amusing story about some folks who stepped up to help make that wait a little more pleasant. Suzanne?
Thank you so much, Governor. I just want to tell your viewers how grateful we are to you and the state for supporting our testing efforts. Ever since the spring, we've been testing out in the community with support through the state with CARES dollars, testing high-risk, vulnerable communities. That's the population we serve here at Fairhaven, and I am truly very grateful to you for that opportunity to be able to serve our community. To your point about workforce, I can't stress enough how we're sort of bending under the weight of the demand for testing. The summer was very manageable. We manned a COVID testing line, 2 full-time people. We asked people to call so we could pre-register them. We were averaging 80, 90 calls a day, and that was very manageable. In the past 3 to 4 weeks, we have seen that number more than quadruple. We have welcomed walk-ins, but with that, we're having lines that literally go around the block. And I guess, sort of interesting story that you referred to happened yesterday, Sunday. We recognized the need to test in the weekends for those people who couldn't make it during the workday. So we held a test event yesterday at our local school in the outside at the Columbus Academy here in Fairhaven. And we knew that it was going to be cold. It was going to be raw. The forecast was not great. So the one thing we wanted so badly to avoid was having long lines for hours upon hours. So when we got there around 8 in the morning for a 9 o'clock start, there were well over 100 people already in line, but we came prepared with literally 20 people for that one testing event. We had 4 people signing up patients, 4 people swabbing, but then we had people working the line, giving them phone numbers to call. We had people inside taking those calls to register them so that when they got to the front desk, all they had to do was sign in. We managed to get through that line in about an hour, such that by the time 10 o'clock rolled around, we were testing. Nobody was waiting more than 15 minutes. We continued to test consistently through that 3-hour period. In 3 hours, we tested over 330 patients, but nobody had to stand in line for very long. And we were so grateful to be able to do that, but it literally took a village, as they say. We had 20 people there with IT, facilities, runners, and all the swabbers and the those at the front desk. And we recognized that there was going to, it's pretty dreary standing in line waiting to get a COVID test. So I have to give credit to my staff. It was my staff's idea, but we brought in a mariachi band to play during the testing. And I was there myself the entire time, and it definitely lifted the spirits. And it was a little bright spot in an otherwise dreary day in a time that. So my message, Governor, is that so many people in the state, all health centers for sure, and others, are doing our best to test as much as we can. We need more workforce, as you just mentioned. We are the place where we need the most help are people with that registration. We need to get them trained fairly quickly on our EMR. We're on Epic, but the same is true for people with other types of EMRs. That's the bottleneck right now, and we're grateful. We're getting some of your National Guardsmen next week, so that's going to help for sure. And that's our story. We're here. We're doing our best. We're also testing in 8 nursing homes as part of your Care Partners program, where all nursing homes are getting tested on a weekly basis. It's a lot of work, but I think everybody recognizes the importance of it.
Well, thank you very, very much, Suzanne. And if any of you play an instrument, you want to do some performance and cheer up some people waiting in line, I think Suzanne's story reminds you of that. Hey, Miguel, give us just a little insight into what's going on with schools as we get ready for the Thanksgiving break.
Thank you, Governor, and good evening, everyone. Yes, I'm really pleased to share that due to the great planning in the summer months and the fall months, we were able to provide in-person learning opportunities for roughly 350,000 students. And I just want to thank all the educators, the parents for their flexibility, and for your commitment to making it happen. We know that there's no replacement for in-person learning, and those efforts will continue. But we've been able to give in-person learning opportunities for over 350,000 Connecticut students, which is about 70% of our students who opted for that option. And we're pleased with that. And because of those efforts, our students have more opportunities for in-person learning in Connecticut than some of our surrounding states. So just wanted to say that, in the week of Thanksgiving, that's something that we're really thankful for, the opportunity that our students got in Connecticut.
Well, thank you for giving them that opportunity. All right, Max, Josh, and Paul, Suzanne, Miguel, we're ready.
NBC Connecticut.
Good afternoon, everyone. Regarding the Safe Schools, Successful Schools Now report that came out with teachers unions, they're saying that Connecticut must move all schools to remote learning or create and enforce statewide protections for any in-class education, saying that to date there has not been adequate testing of students and staff to determine spread and scope of infections within schools. Wanting to get whether, Governor, maybe your reaction, the commissioner, to that, as well as what the threshold is, if you have one, to go remote only for all schools.
I think our schools have done an extraordinary job putting public health and safety first. Melissa McCall, way back early in the summer said, tell us everything you're going to need to keep your kids safe. And that included masks, and worked on ventilation, worked on disinfectant, what we had to do there. Josh has put testing preeminently up front and made sure that any teacher or student want to get tested, they'd be able to get tested. I can't mandate that, by the way. Right now, Miguel is going to all the schools, are bringing Binax testing. Binax is, we got 50, 75,000 a week. We can get those to the schools. A lot of them were in the colleges before. That gives you an immediate 15-minute response, tells you whether you're tested positive or negative. And that's also part of why we're getting, the young people there as well. If we can get those apprentice teachers in there, if you're an older teacher that doesn't feel safe, an older teacher that feels like you ought to be quarantining, we can get somebody younger in to complement your teaching from remote. So we're doing everything we can to give these kids the best shot as long as we can do it safely.
Thank you, Governor. And I would echo those comments. I think you laid it out nicely. But, I think the key thing to remember is health and safety is still going to be the primary indicator of whether or not schools should be open. As you know, we made the decision to provide guidelines and allow local health directors and superintendents to be looking at the local factors which determine whether or not those schools should be open. And decisions have been made based on the local factors around when to close schools. So I don't know that one universal number is the best way to approach it. In some cases, the community spread is greater than in other cases. So we need to let the experts at the ground level that have the experience looking at what's happening in their communities make the ultimate decision.
Regarding Step Up Connecticut, how long do you expect needing volunteers on those paid positions? Any idea how many people are needed, and will they have the PPE provided for them as well?
You know, we certainly have the, masks and gowns and all the protective gear that you need. How long to be determined. I do know that many of the colleges are planning to, their kids are coming home now, and they'll be at home probably through the end of January. So, minimum, we could use you for a couple of months and then see what happens from there.
And then lastly, regarding Thanksgiving and Black Friday, and any last minute suggestions, advice, thoughts, predictions?
Just be careful. I mean, we're doing everything we can to allow your family to have a nice Thanksgiving, a different Thanksgiving, a smaller Thanksgiving, but a Thanksgiving you can do safely. And I'd say the same thing for Black Friday. We're finding the retail can be operated safely as long as you keep the distance and wear the mask. It's going to be, we'll have to take a second look, though, if people can't self-police that way and make sure we keep everybody safe in that store. And frankly, if the store's not self-policing, fewer people are going to want to go in. So be careful. We'll have a good retail season as well.
Thank you so much.
Channel 3 Eyewitness News.
Yes, Governor, you made a good point recently about nurses and doctors saying that during our first wave, we could pull from other states that weren't seeing surges. But if we're all seeing surges right now in this second wave, who do we turn to? And I know that you're rolling out the Step Up CT program asking for volunteers, but when it comes to nurses and doctors, are we fearing that there might be a shortage?
If I thought about where there's risk, it would be in people. And you're right. That's why I'm trying to get folks who have got some healthcare experience to get back in the game. We could use that. Last time around, with elective surgeries slowed down, that freed up a lot of healthcare workers who are otherwise able to deal with COVID. I hope we don't have to get there because the elective surgeries are really important as well. But those are two places where we might be able to fill the need.
And Governor, it seems like you're going all in on just curbing these small gatherings during Thanksgiving. So, since local police are the ones who are enforcing the executive orders regarding gatherings, does this mean that they can control on Thanksgiving looking for a lot of cars in driveways and then issuing citations? Is that something that they can do? And is that something that you would suggest they do?
Look, I don't suggest that. That's not the way this thing's going to work. We can't go into people's houses and say there are 11 people sitting around the table and one of them you met a week ago. What we can say is if you care about your family, you care about your community, please keep it to 10 people. These things have got to be self-regulated and self-policed. So, if there's a big raging party going on and we get some complaints, we'll be there.
News 12 Connecticut. Fox 61.
Hi, Governor. Some health officials are calling this winter the last big battle against COVID. Obviously, we have that vaccine on the way next year. Can you talk about the importance of that in a public health capacity? And when and if are we expecting a peak in cases?
I think most of the models that you've heard us describe and we've seen from Scott Gottlieb and others implies that January, late January could be the peak. In terms of going forward, I don't know if I followed your question, but look, we've got the vaccine. We're going to have it broadly distributed, I think, by early summer. That means in time for a flu season next fall. I'd like to think that the vast majority of our people have been vaccinated not once, but twice. You remember in 1919, you probably don't remember, but you've heard tell, it ran out the pandemic at the end of the second fall, the second surge, but there were flare-ups that kept going for another year or so. Hopefully we'll be able to avoid that.
News 8. News 8. WTIC 1080 News.
Mr. Governor, how's the vaccine group coming along? It sounds like AstraZeneca has a product which is going to jump in. Is organization a big challenge with all this different information coming in?
Hey, Josh, why don't I hand that over to you? I mean, we just got off the call with the White House task force in terms of the vaccine and the distribution and the timing and additional entrants coming in. Josh?
Sure. So Commissioner Gifford and I joined the governor on a Operation Warp Speed call with the federal leadership earlier today. And yes, it's encouraging and it's exciting. We are awaiting, hopefully, FDA review in the very near term of the first two vaccine candidates that have been submitted for approval. And as you mentioned, a third vaccine candidate published very promising data this morning as well out of the UK. So we're hopeful that we will have doses on the ground in Connecticut ready to start to deploy before the end of this year. And Commissioner Gifford and her team and the broad advisory group that we've convened are working very hard to ensure that we have all the preparations in place to get those doses out quickly and administered quickly so that we can start to turn the corner on this pandemic as we head into the new year.
On the advisory group call last week, they talked about messaging and communications. Are we going to see a big advertising effort around this?
We will, and that'll evolve over time as we work our way through the priority populations.
Connecticut Public Media. The Associated Press.
Hi, Governor. Just want to know if you're still COVID negative.
So far, so good.
Okay. And also, the state has been opening some COVID recovery centers to help out with the nursing homes. What's the status of that now? And how many COVID recovery centers do you think will need to be opened?
I think I'll pass that one along as well. But let me just say that of late, we have a majority of our nursing homes now have at least an infection. So we're doing a lot of testing in these nursing homes and getting results back in real time. A lot of the Binax tests went there, so 15-minute time. Remember last spring, you got a test and it took you 5 days to get back. And by then, a lot of bad things could happen. And part of that is going to be the COVID-only homes. But Josh, you want to fill in there?
Yeah, so we have 3 COVID recovery facilities that we have.
Last spring, you got a test and it took you 5 days to get back. And by then, a lot of bad things could happen.
Okay. So, yeah, to answer the question on the COVID recovery facilities, we have stood back up 3 of them that we had put in place back in the spring surge. We've reactivated those. They are taking admissions, both from our hospital discharges, as well as in support of existing nursing homes who are having challenges cohorting positive residents and need to create some more breathing room. We have a 4th facility that's able to be turned on if we need to, and the team at DPH has worked with some of our partners to do a lot of modeling around what severe scenarios could look like to make sure that we have enough capacity in our COVID recovery facilities to meet those different, kind of worst case models. So we are confident we'll have adequate capacity in those COVID recovery facilities throughout the winter. It's just one of the areas where under the governor's leadership, we have worked hard over the summer to ensure that we're much better prepared for a second surge.
Thank you.
The Connecticut Mirror.
Thanks, Max. Governor, 2 questions. I'll get the COVID one out of the way first. I wanted to ask you about Black Friday. You had talked earlier, you said, hey, if there are large parties, we'll be all over that. Are you worried that Black Friday could just amount to a series of effectively the types of gatherings that are like large parties all over the state?
Yeah, I worry about that, Keith. That's why we told the Retail Association last week, we need your help on this. We're doing everything we can to keep your stores open. And but if we find that there's a lot of evidence of casual behavior, you know, in some of those big malls, those common areas where hundreds of people are congregating, that's at risk to themselves and our greater community. So we'd have to take action. I think we're going to get it right, though.
Okay. Governor, I also wanted to ask you quickly about the budget and the transportation fund. You know, we had a report last week from your administration and from OFA saying that the STF, the Special Transportation Fund's in trouble again. We know the legislature didn't want to act on tolls. We're due to put some more sales tax money in the transportation program over the next 2 years, but you've got a problem with the general fund balancing that too. Would you be looking potentially to scale back again the sales tax money we put in the transportation fund, or are you more disposed to leave things as they are scheduled?
Right now, we're scheduled to move that sales tax money over to the Special Transportation Fund. It doesn't really impress me as a strategy. Let's borrow from Peter to pay Paul. Instead of making the tough choices we need to do to figure out how we can shore up our Special Transportation Fund. I mean, more and more people are driving electric vehicles. This last year, a lot less driving, lower gas prices, no money coming in. And it really is a very important time to be able to get down to the federal government and say, we're ready to make infrastructure investments. But let's slow up as we think about our options. And very possibly coming out of the Biden administration, there'll be some transportation grants and other ways that we might be able to keep our infrastructure plans going.
Just to clarify then, Governor, so you're not ruling it out, because the fact of the matter is the legislature hasn't really given you a long-term solution yet. So if I'm hearing you correctly, right now, you can't say that sales tax money is definitely guaranteed to go over to transportation in your budget proposal.
Right now, it's scheduled to go over to the Transportation Fund. No question about that. What I'd like to do, though, is sit down with the legislature and give some broader ideas about the best way to shore up our transportation in this state.
Okay, but in terms of what you're going to propose, I just don't want to misunderstand this, Governor. I understand in law right now it's supposed to go over, but we can always change the law and have repeatedly in the past.
Yeah, I have no intent to change the law, Keith. I have no intent to, change the intent of the legislature. My life would be a heck of a lot easier if either they could vote on a plan or the federal government could step up. I think people knew what my plan was.
Thank you, Governor.
Yep.
Hearst, Connecticut Media.
Thanks, Max. So, Governor, since March, the state's now at more than 101,000 COVID cases. And I have to ask, are you just trying to get the state's economy through the holidays before you order another statewide lockdown? And if so, what metrics would you use to determine that?
I think we're going to look at the numbers every week, and I'm going to look at the numbers alongside my regional governors. You know, as you know, let's say gyms or restaurants, we see the potential for spread there. And but for me to do that by myself, or one municipality to do it by itself, is 1/100th effective as if we did something on a regional basis. Right now, nobody thinks we're in that place yet, but those are some of the options we got to consider if the metrics don't get better.
Thanks. And then this one's probably for Josh. What is the capacity on those 3 COVID-only nursing homes that stood up, and how many nursing home residents have gone to them versus how many hospital?
There's about 300 beds between the 3 that are already open right now. About 250 beds between the 3 that are already open. There's the 4th facility is another 126 beds that's available, and we're also scouting, a 5th as well. So, we should have plenty of capacity there, because remember, folks tend to not stay in them for too long. Oftentimes, it's a transfer point for them to get well and head back to their original nursing home. So we're confident we'll have more than adequate capacity.
Do you have an idea on percent how many home versus how many hospital patients?
I don't have that breakdown in my fingertips here, but we can get that to you.
Thank you.
The Day of New London.
Hi, Julia Bergman with The Day. Lawrence and Memorial Hospital today is reporting 35 people hospitalized related to the coronavirus. It's a record high for them throughout the entire pandemic. Are there discussions or plans in place to reactivate those field hospitals or that surge capacity that the National Guard set up? And if not, kind of what factors would go into deciding whether or not to do that?
I think the lead factor, Julia, is capacity. Capacity there and in the region. And as you know, as we said before, it's not like I can send people to Hartford Health or down to Stanford or something because everybody is filling up at the same time. You know, that said, broadly speaking, in the state of Connecticut, we have about 50% capacity. We have more capacity in our hospital beds and ICUs than most other states around the country right now. We're going to husband that carefully. And the good thing about the field hospitals is we can get them up in 48, 72 hours. So that's one thing that we can move on pretty quickly, thanks to our amazing Connecticut Guard.
And then one other question. Earlier, when you showed the graph mentioning the 10 random people gathering together at the various counties, can you elaborate on how you actually got to those numbers, the percentages that you got to?
I think the way those numbers came up is a 6% positivity rate. You can stay positive for, say, 14 days during quarantine. Some math there, take 10 people, and they came up with those numbers. But what they're really meant to tell you is there is risk. And there's risk with 5 people, there's risk with 10 people, and you can mitigate it by limiting the number of people. Many fewer people you'd have to track and trace if that was the case. And much better if you stick to your immediate family because you know who they are pretty well.
Thank you.
Yep.
The Hartford Current.
Hey, everybody, this is Emily Brindley from The Current. Governor, to begin with, I wanted to ask you about the Vaccine Advisory Group. At their meeting last week, Commissioner Gifford mentioned the federal funding, the lack of federal funding, I should say. So I wanted to ask you, if the federal funding doesn't come through, or if not enough of it comes through, is there a backup plan here? Like, is there another place that money could come from to help the state really plan for this distribution process?
Yeah, it's called the Rainy Day Fund, Emily. I hope I don't have to take it, but if we will, we will, because in public health and getting ready for the vaccines, making sure we can get that out, delivered on a timely basis. If the federal government can't get its act together, we're not going to shortchange the public health of the people of Connecticut. Hopefully we get reimbursed once, House and Senate get it together, but regardless, we'll be ready.
Is there a certain amount of money that you'd be willing to take from the Rainy Day Fund? Like, how much would you be willing to reallocate toward a distribution plan?
I hadn't really thought about it in that sense. I just think that when it comes to a vaccine, getting that distributed in the most effective way possible, I don't think I can, pinch pennies on something like that. We're going to do what it takes to get it done.
Okay, and then I also wanted to ask about the map that you shared with the risk of gathering with 10 people. You mentioned that that's the risk if there's kind of like 10 random people selected. Does that also apply then to like classrooms? Like if there's a classroom of 10 people, is it the same % risk that somebody in the room has COVID?
Well, no, for a couple of reasons. One, in the classroom, everybody's wearing a mask. That makes a big difference. 2, in the classroom, depending on the age, you're generally younger or even much younger, so much, much, much less likely to shed the virus.
And one last quick question. Are you guys going to be releasing the daily numbers on Thursday and Friday, or are we going to have a 5-day lag until Monday?
I think we're going to release them.
Yeah, the team is going to take Thanksgiving Day off, but we will release data on Friday, which includes the data from Thursday and Friday.
Okay. All right. Perfect. Thank you, guys.
Thanks, Emily.
CT News Junkie.
Thanks, Max. Governor, I was wondering, what are we seeing through contact tracing? For a while, you guys were kind of saying that it's small gatherings, that this thing is spreading. You've had the 10-day sort of, or not 10-day, sorry, 10-person cap on gatherings in place for a while. Is that still the predominant vector, or has some other vector emerged as a spreader?
Well, I'll start on this. I mean, the contact tracing, working a lot with some of my neighboring governors as well. Charlie Baker up in Massachusetts saw sports, club sports, hockey is a place where there was spread. They're able to trace back to that. They're doing a very deep analysis right now in restaurants, so we're going to follow that as well. But I think your basic point is well taken. I believe it's still those informal social gatherings where you're most likely to lower your guard. That's what we're worried about. Anybody else on the call have insights there?
No, that's correct. That is still the most common source of transmission, those informal events where people you know and trust, and you let your guard down. You don't think you need to wear a mask, maybe too close indoors. And it's why the governor has been so clear about the risks as we head into the holiday season here, too, where we have more of those gatherings. And just another reminder for everyone that to use extra precautions, make sure you're wearing your masks and keeping your distance, and we can get through this.
It's been almost 3 weeks now since Election Day. Do we have any evidence if that was a major spreading event? A lot of people get together, standing in lines, that kind of thing.
No, we have not. We have not had, I don't think, any documented cases of transmission related to Election Day activities. And again, think of why. If you look at the polling places, or if you were in a polling place, everybody was wearing masks, right? People were keeping their distance. And, you know, when you have those conditions in place, you know, masks work, and they're actually quite effective when everyone's wearing them and preventing spread. And the teams that worked on Election Day did a phenomenal job following the rules. Everyone who went to vote seemed like did a great job. And so as a result, we didn't see cases of spread.
Governor, on the Step Up Connecticut front, how many people are you looking for to be volunteering or paid?
It will require mainly on the qualifications of the people we can find, but we could use hundreds, even thousands. And by the way, when it comes to the not-for-profits as well and delivery of food and helping food share, there's a lot of work we got to do over the next few months. So we do need people to step up. We're trying to make it easier for you to do so. And a lot of the jobs are paid.
Are they jobs are they state jobs? Like who's paying for it, I guess?
Well, when it comes to, for example, testing, Suzanne, do you want to talk about that?
Absolutely. So the testing, we are getting reimbursed by the state. The governor committed dollars through the CARES Act for us to test vulnerable, high-risk communities, and that's what we're doing. I can say that we will hire. We will be paying for whoever we can find to do these jobs. We're all in this together, whether the funds come from the governor, whether they come from the feds, whether they come from donors, we will get the dollars to make this happen. The bottleneck is clearly finding people who have the skill sets, getting them up to snuff quickly.
And just one last, what sort of skill sets are you looking for? Can anyone apply? Well, go ahead.
I can tell you from our perspective, the biggest one is somebody who can get up to, who has the IT skills to learn quickly how to register people in our EMR, which, as I said before, is Epic. But again, same is true for all other health centers, all other people testing. We have to get these patients registered so that we can order the tests, so that we can then call them back with the test results. And that just takes time, and it takes knowledge of our system. We're up and ready to train them, but they have to have the willingness and the ability to do that. For those of us working in communities like Fairhaven, we're always looking for people who are bilingual, but even that is not essential. It's wonderful when we can hire somebody who's bilingual because it makes life so much easier, but it's not critical.
The Waterbury Republican American.
Thanks. Governor, can you explain why you can't mandate universal testing of students and teachers?
I believe that we won't have to. I believe that people can do it on a voluntary basis. Is much more effective than me mandating you take a test. I want to give everybody incentives to get vaccinated on a universal basis as close as we can do it. And hopefully that won't require any mandates.
Yes, but your answer earlier, you said you can't mandate it. Did you just mean that you
I just think it's really complicated to tell a teacher you've got to get a test. I can say, here's a test. It's readily available. It won't cost you anything. I can get you a response in a very near-term period of time, and you're taken care of if you test positive. But for me to mandate that, I think is quite complicated.
Yeah, Paul, I mean, you've got collective bargaining agreements for the teachers, right? And then for the students, you need parental consent. But I think you're missing the forest for the trees here. We've done almost 250,000 tests in the state of Connecticut in the last week, including record numbers of tests of school-age children. So, people are coming out to get tested in record numbers. We're getting the understanding we need in the schools of where there are challenges, and our public health teams are working with our superintendents to take the right action. So, and that's not even with with Binax still continuing to go out in more volume. So we've got very broad-based testing coverage across our school-age population, our teachers already.
Well, I was just seeking to clarify a point that the governor made earlier when he said he couldn't mandate tests. Commissioner Cardona, can you tell us how many other school districts are now participating in that pilot program with the Binax test?
Sure. We have at least 20 districts in the pipeline now working through the partnership with their local health provider to provide the tests, and more districts inquiring about their ability to do that. So the numbers should grow.
What's the current hospital capacity, and what's the capacity of ICU beds?
So we are at 74% of our staffed beds in the state are currently occupied. That number's been pretty steady for weeks now, and we're 58% of our ICU beds are occupied, which is up a little bit, but still just above half of our ICU capacity.
And how many of those ICU beds are occupied by patients with confirmed cases of COVID-19?
30% of the ICU beds that are occupied are COVID positive.
Okay, thank you.
Welcome.
No more questions.
All right, well, let me just say, I love this Step Up Connecticut, and I think it's a real opportunity for everybody to participate if they so feel. Whether it's the love of kids and teaching and education, help out in our classrooms, whether it's healthcare and the importance you could do there. Suzanne Lagarde, thank you so much for explaining exactly how people can help with the testing. And if you got a musical bent, you can do a little karaoke or any other type of music to keep people in those lines as we speed them up so people get tested and we keep you safe. God bless you and happy Thanksgiving.